EBMT originally was professional associations created to evaluate and promote the use of stem cell transplantations. And although CAR T-cells are different because they represent the transfer of cellular therapies to the industries in many aspects, they also raise and create common problems with stem cell transplantations. And in particular, EBMT has a very important asset, which is its registry, and the registry will be used in the future to register and to capture the data for patients treated with CAR T-cells. There are ongoing discussions with the European Medicines Agency, EMA, to qualify the EBMT registry. We are talking with the major industry players in the field to capture data for patients treated with these new treatments. And the two other pillars in the EBMT strategy are education and accreditation. Accreditation based on FACT and JC standards. We are designing a specific set of standards to be used with the immune effector cells therapy independently of transplant activity, and this could be used as one of the criteria to qualify centers for CAR T-cells administrations. And obviously education, this meeting is a very good example of the initiatives that EBMT is promoting together with other interested parties such as the European Hematology Association, EHA, to bring knowledge and experience to European investigators in this new field.